Thank you. Well, good morning or good afternoon, everyone. Thank you for the organizers for inviting me to give these two presentations. So the first presentation I have is on really the relationship between the incidence of dengue and the COVID-19 movement restrictions. And the relationship we surprisingly, to some extent, saw with the density of the Aedes mosquito vectors of dengue virus. We thought this would be rather interesting. So this work was done in the northern Jaffna Peninsula in Sri Lanka, centered around the University of Jaffna, Department of Zoology. So to give you the background on COVID in Sri Lanka, it was first detected in February 2020. And very soon afterwards, there were a series of public health measures that were introduced to restrict contact between people, including the movement of people, from the 17th of March 2020. And this was in place throughout most of 2021. So the kind of restrictions that were introduced included stay-at-home orders from time to time, closure of schools and universities, and when these were relaxed a little bit, even restrictions on travel between the different districts, of which there were 25 in the whole island. Limited vaccination was initiated towards February 21, and it was a very slow progress. So vaccination, we didn't think had a serious impact on what I'm about to present. Now, dengue is a notifiable disease in the country. So physicians and clinics have to report any patients with dengue to the public health authorities. So it's recorded in the Ministry of Health for monitoring purposes and also for keeping statistical records. Now, the population in Sri Lanka has been used to very rapidly accessing good health care. And this was true for all sorts of medical conditions, and also true for malaria when it was prevalent in Sri Lanka. Malaria was eliminated in 2013. And it continued to be true also for dengue. We had reports in 2020 itself of reduced reporting of dengue incidents. And we decided to investigate this using a well-known model which is used quite a lot in environmental sciences and geography, called the seasonal autoregressive integrated moving average model, which we used to predict the dengue incidence that was expected during the movement restriction period, March 2020 to April 2021, which was a study period. And this was based on the pre-pandemic data for 5 years, from January 2015 to February 2020. So the predictions were fairly robust based on 5 years of pre-pandemic data. And we use a seasonal model because dengue incidence in a typical tropical island like Sri Lanka is very much related to the rainfall. So rainfall increases vector densities, and that in turn leads to increased dengue transmission. So very soon after peak rainfall, which occurs during 2 monsoon seasons in the island, very soon after the rains, the dengue incidence goes up. So this is a very well-established pattern, and it's probably true of many tropical countries. Now, what was very helpful to us is we have been doing ovitrap collections of Aedes aegypti and Aedes albopictus, that is, laying out traps for collecting eggs and where the eggs hatched into larvae in the natural situation, usually placed in specific areas. And we've been doing this to study the vector bionomics in the Jaffna Peninsula for various other purposes. So we had this data from the pre-pandemic era, 2019 year. And we continued this during a part of the period when there were public health restrictions in 2020 and 2021. The public restrictions, movement restrictions didn't apply wholesale to everyone in some situations. For example, you could still do at various times scientific research like COVID trap collections, and you could move freely to travel to medical clinics, which are kept open, to report any medical conditions or seek hospital treatment. And very limited shopping. One person from each household could go shopping even during the stay-at-home order. So this was the background. And so this is a graph that shows the relationship between the actual numbers of reported dengue cases in the 5 pre-pandemic years and during the movement restriction period, with the actual with the predicted numbers of dengue cases predicted from the SARIMA model. So the can you see the pointer? The green. Can everyone see the pointer? Hello. Yes. Good. So this is the green line, which is the actual number of reported cases of dengue. And you can see that when the movement restrictions were introduced soon after, in March 2020, the reported cases actually was much lower than the predicted cases, predicted on the basis of the model. So we had hints of this, and so this was a more detailed analysis that was done in Jaffna. We also looked at each of the 25 districts. And again, we have the reported number of dengue cases here in green and the predicted number of cases in red. And you can see there was a universal reduction in the number of reported cases compared to what we expected from the typical seasonal distribution. Except, and this was statistically significant, except in Batticaloa, this district, where there was a slight reduction. And this district was characterized by a cyclonic depression in the Indian Ocean, which is a coastal district. Which the cyclonic depression really produced an awfully unexpected amount of rain during one of the monsoon periods, 2020 to 2021, in the sort of December-January period. But it was still reduced. And then we looked at this in greater detail in the district of Jaffna, which is where the university is located. And you can see the rainfall in the bar graph shows typical increases, particularly during the sort of towards the end of the year, when you have the northeast monsoon, which is the strongest monsoon possible, sometimes a little in June, July. So certainly during the end of the year period, you have this increase in rainfall. And that is accompanied by a rise in the number of reported dengue cases soon afterwards, or coinciding almost with it. Now, so we predicted in September 20, towards the end of 2020 and early 2021, that there would be an increase, and this is the red prediction graph. But the actual numbers that we saw in the Jaffna district, which is a much smaller area, of course, than the whole island, was typically low. So we had detailed data from almost every district which supported this kind of observation, but particularly so for Jaffna district. Now, to move on to the dengue vector observations. Now, we had published the earlier data in relation to some other project on the dengue data in 2019. So this data is published separately, but we had this data to compare. This is pre-pandemic data. And these obi-traps are placed within the city of Jaffna in a very specific area, set of, well, it's a fairly large location, but a number of different obi-traps, 9 were placed. And we found that if you look at the two major vectors, the major vector is really Aedes aegypti. Aedes albopictus is a secondary vector of dengue and also of chikungunya in the country. And if you looked at the data from 2019, which we had published separately before the pandemic, which we didn't know anything about the pandemic. So these were the typical ovitrap collections. We saw, out of 9 ovitraps, quite a large proportion were positive for Aedes aegypti, and also a number of ovitraps were positive for Aedes albopictus. And the numbers of Aedes aegypti collected during the monthly total numbers per month, collections were done more frequently, was quite high. When you compare it with what happened in 2020 when we had the movement restrictions, you can see the ovitrap collections of Aedes aegypti was really done. Out of 10 ovitraps, 2 here in August. We didn't do this part because of the logistics of movement restrictions and so on. So we could only commence this work in August 2020 and continue it into 2021, April. And quite a very significant reduction in the number of ovitraps that had Aedes aegypti larvae, and also a very significant reduction in Aedes albopictus. More albopictus was collected than Aedes aegypti during the movement restrictions, whereas it was exactly the opposite in 2019. So overall, there was a something like a 90% reduction in the total number of Aedes larvae that were collected. And this was coupled with about 70 to 80% reduction in the incidence of dengue in various parts of the country. So based on this, we came to the following conclusions. Now, movement restrictions have been suggested to be associated with dengue transmission in some epidemiological studies carried out in the US, but it's really not been well studied from an epidemiological point of view, as far as we know. What we observed was clearly that during this period, when there was a very drastic reduction in movement restrictions, there was a lower dengue incidence. But what we propose is that the movement restrictions in all parts of Sri Lanka led to a reduced access to blood meals by Aedes vectors, and also consequent to a decreased human biting rates, because for some reason the people not going out of their houses did lead to a reduced transmission. Aedes aegypti is primarily not a night biting mosquito. It does tend to bite during the daytime, and it also rests close to houses, not necessarily inside houses. So the reduced blood meals and decreased human biting rates led to a reduced vector density, particularly of Aedes aegypti. And this is based on the data from the Jaffna city, a very small area. And we propose this would lead in turn to reduced entomological inoculation rates for the dengue virus, the reduced transmission. Reduced vector densities and human biting rates have a major impact on dengue transmission rates, as modeling studies have shown for many years. And that, we postulate, causes a reduced lower dengue incidence. Now, we also have to think that perhaps there were a lower reporting rate because people were also not easily able to travel to hospitals and medical clinics, although they were allowed to if they had illnesses. They might have been frightened of being suspected of having COVID-19 or whatever. So that is probably, we have to allow for a small contribution there. But I think our new proposal is that it is the reduced human biting rates and blood meal availability that led to reduced vector densities, and which in turn led to lower dengue transmission. Clearly, this is not an experiment we can carry out again easily. What we do know is that when the movement restrictions are removed, for example, this year, the dengue incidence rates went right up. And we are analyzing very limited Aedes vector data that will be available in Jaffna. But clearly, what's clear is the dengue incidence rate shot back up normal rates. So thank you very much, and happy to answer any questions on this.